Hygiene is the term used to describe practices that we follow to keep our bodies clean and healthy. Grooming refers to practices like fingernail and hair care. Hygiene and grooming activities, as well as dressing, preparing meals, and eating, are all called activities of daily living. In some states, CCAs are allowed to perform assistance with personal care. In other states, they're not. Ask your supervisor for clarification of what your state law allows regarding personal care. Regardless of your state's stand on personal care, you'll still need to pass the test on this chapter to get your CCA. We all have routines for our personal care and activities of daily living. We also have preferences for how we want them to be done. These routines remain important to us even when we're elderly, sick, or disabled. Be aware of your client's individual preferences concerning their personal care. They may prefer certain soaps or skincare products. They may choose to bathe in the morning or at night. It's important to ask them about their routines and preferences. Before you begin any procedure or task, explain to the client exactly what you'll be doing. Ask if he or she would like to use the bathroom or bedpan first. Provide the client with privacy and let him make as many decisions as possible about when, where, and how a procedure will be done. During the procedure, if the client appears tired, stop and take a short rest. After completing a procedure, always ask the client if there's anything else they would like. Providing or assisting with personal care gives you the opportunity to observe your client's skin, mental state, mobility, flexibility, comfort level, and ability to perform ADLs. For example, as you bathe a client, observe the skin color, texture, temperature, and whether the skin is dry or moist. Is it pale, yellow, ashen, or flushed? Are there blotches or a rash? Is there redness around any bony area? Is the skin dry and flaky? These are conditions that may only be apparent when you're performing personal care, and they can be very important indicators of the client's health. Many clients will talk about signs and symptoms they're experiencing during the time their personal care is administered. They may tell you that they have been itching or their skin feels dry. They may complain of numbness and tingling in a certain part of the body. Keep a small notepad in a pocket to jot down exactly how the client describes these symptoms, or make notes right away after the procedure. Remember to report these comments to your supervisor and then document them according to your agency's policies and procedures. You should also observe the client's mental and emotional state at this time. Does the client seem depressed or confused? Can the client concentrate on the activity or hold a conversation? Is she short of breath when moving or performing care? Does he tremble or shake? Is the client having trouble using certain muscles or joints? Make note of anything that differs from the client's normal state. You may not know every sign and symptom of every possible illness, but you're not expected to diagnose an illness. You're in the best position to observe, report, and document any small change in your client that might suggest an illness. No matter what care task is assigned to you, performing the task is only half the job. Licensed nurses once performed much of the care that you're giving. As the nursing profession became more specialized in the medical side of care, these duties were delegated to family and professional caregivers like you. Your role as a CCA is to make certain that small, subtle changes in a client's status do not go unnoticed. After you've finished a procedure, check the client's room. Is it a comfortable temperature? Is it well ventilated but free from drafts? Does the client have an easy way to signal you for help? Does the room have good lighting? Are there electrical cords or other objects in the walkways? Is the room cluttered and unsafe? And by all means, be sure your client doesn't smoke in bed. Here are a few guidelines for assisting with bathing. Bathing promotes good health and well-being by removing the perspiration, dirt, oil, and dead skin cells that accumulate on the skin. Taking a bath or having a bed bath can also be relaxing. For clients who are bedbound, the bed bath is an excellent time for moving extremities and increasing body movement and circulation. You should never give a client a tub bath unless you're assigned to do so in the care plan. Many people prefer a daily bath or shower, but this often isn't necessary. The face, hands, axillae or underarms, and perineum should be washed every day, but a complete bath or shower can be taken every other day or even less frequently. Older skin produces less perspiration and oil. Elderly people whose skin is dry and fragile should bathe only once or twice a week to prevent further dryness. When bathing older clients, be careful not to wash the skin too vigorously or it may tear. Before bathing any client or assisting with bathing, make sure the temperature of the room is warm enough. Remove any loose rugs that do not have slip-resistant rubber backings. It's helpful if you're familiar with available safety and assistive devices. Never leave an elderly person alone while they're in the bathtub, and never use bath oils. They make the tub slippery and can cause your client to fall. We recommend you wear gloves whenever you assist clients with bathing. As always, closely follow your agency's policies and procedures. Next are some guidelines for using assistive devices in bathing. Assistive devices such as a tub chair and safety bars can make bathing easier and safer, both for the client and for you. An occupational therapist may come to the client's home to teach you and the client transfer techniques for getting safely in and out of the tub. Occupational therapists help clients improve their abilities to perform ADLs. A tub chair, shower chair, or bath bench is a sturdy chair or bench designed for placement in a bathtub. It's designed to be water resistant and slip resistant. The chair or bench is a great tool for clients who are unable to get down into the tub or too weak to stand in a shower. It lets them continue to bathe in the tub rather than in bed. Safety bars, grab bars, are another good assistive device. They're often installed in and near the tub and toilet to allow the client something to hold on to while changing position. If in the course of performing care for your client you recognize a need for these assistive devices, report the need to your supervisor. There are many other assistive devices available through medical equipment supply companies. Find out if your supervisor has a catalog from a local supplier. It's a good idea to review the catalog and become knowledgeable about what's available. There are 2 procedures that you will need to learn for assisting clients with bathing. Procedure 1 involves helping the client transfer to the bathtub, and Procedure 2 is helping the ambulatory client take a shower or tub bath. Please refer to the CCA manual for details on how to perform these procedures safely. It's vital that you provide the safest care possible for your clients. At some point in your caregiving career, you may find yourself caring for a prosthesis. A prosthesis is a device that replaces a body part that's missing or deformed due to an accident, injury, illness, or birth defect. You may work with clients who have prosthetic feet, legs, hands and arms, or even eyes. Prostheses are specially fitted, expensive pieces of equipment, and an artificial leg, for example, may cost from $10,000 to $20,000. Because of this, you should only care for prostheses as assigned in the client care plan. Make sure you know exactly how you're to care for the equipment before you begin. If you have any questions, call your supervisor. That covers bathing. Now let's look at some guidelines for assisting with grooming. When assisting a client with grooming, remember to always allow the clients to do all they can for themselves. Follow the instructions in the care plan for what care to provide. Some clients have a routine. Try to work with the client to establish a routine that includes everything in the care plan and satisfies the client. Be professional, be respectful, and be cheerful while assisting your clients with grooming. Allow the client to choose his or her own clothing for the day, but do check to make sure it's clean, appropriate for the weather, and in good condition. Encourage your client to dress in regular clothes rather than night clothes. Wearing regular daytime clothing encourages more activity and out-of-bed time. Elastic waist pants or skirts are easy to pull on over the legs and hips. Make sure the elastic waistband of all clothing, from underwear to outerwear, fits comfortably at the waist and nothing is twisted. These guidelines should be followed when assisting with dressing. The client should do as much to dress or undress himself as possible. It may take longer when the client dresses himself, but it helps maintain his independence and regain self-care skills. Ask your client to tell you when your assistance is needed. Provide privacy. If the client has just had a bath, cover him with a towel, robe, or bath blanket and put on undergarments first. Never expose your client more than you need to. When putting on socks or stockings, roll or fold them down so that they can be slipped over the toes and foot and then unrolled up into place on the leg. Make certain the toes, heels, and seams of socks or stockings are in the right place. For a female client, please make sure her bra cups fit comfortably over the breasts. For clients who have weaknesses or paralysis on one side, place the weak arm or leg through the garment first, then the strong arm. When undressing, do just the opposite. Several types of adaptive aids for dressing, such as long-handled hooks and pulls, are available to help clients maintain independence in dressing. An occupational therapist may be involved in teaching clients to perform ADLs using adaptive equipment. That ends Chapter 11. Now let's go back to Steve for Chapter 12.